Today we're going to be going over blood pressure in accordance to the ACSM guidelines. Today my participant is going to be Brandon Brown. When beginning blood pressure testing, the client should be seated 5 minutes prior to the testing. They should have their feet planted on the ground and their back supported. No nicotine or caffeine should be ingested 30 minutes prior to testing. Their arms should be in an elevated position at heart level with sleeveless attire. The appropriate cuff size needs to be used when strapping the blood pressure cuff on the client. 80% of the client's left arm needs to be wrapped. The cuff needs to be aligned with the brachial artery. Once the cuff is on the client, the stethoscope is ready for use. The prongs need to be facing outward when inserting in ears. The knob on the stem needs to be rotated clockwise in order to hear the Korsakoff sounds. Check for sound by lightly tapping the antecubital. You will now place the antecubital over the client's brachial artery, pumping 200 millimeters of mercury. Once 200 millimeters of mercury has been pumped, you will release 2 to 5 millimeters of mercury per second. You will hear 5 sounds. The first sound is the systolic reading of the client's blood pressure. The final Korsakoff sound is the diastolic reading of the client. The client's blood pressure was normal. A normal blood pressure includes a systolic reading of 120 millimeters of mercury and a diastolic reading of 80 millimeters of mercury. Any levels higher than this reading indicate prehypertension or hypertension blood pressure. Prehypertension includes a systolic reading of 120 to 139 millimeters of mercury and a diastolic reading of 80 to 89 millimeters of mercury. A client who is at risk for hypertension includes a systolic reading of 140 to 159 millimeters of mercury and a diastolic reading of 90 to 99 millimeters of mercury.